everyone, it's good to see you again and it's good to be back. My name is Adama Odefa from the Diabetes and Hypertension Help Society, DHS. Just read downwards, you will know what DHS is all about. Today I'm going to talk to you about something that we've received so many queries about and we think is expedient that will bring knowledge of this condition to everyone else. Today we're talking about hemorrhoids. Hemorrhoids. Now, hemorrhoids are painful, swollen veins in the lower portion of the rectum or anus. They are also known as rectal lump. They are also known as piles, and then they're also known as lump in the rectum. Now, this condition is very common, especially during pregnancy and after childbirth. Hemorrhoids result from increased pressure in the veins of the anus. Now, the pressure causes the veins to bulge and expand, making them painful, particularly when you're sitting down. So you can imagine if you have to sit down in a class or sit through a conference or a long flight and you have hemorrhoids, it could be very painful. Now, the most common cause is straining during bowel movement. Don't push too hard. Come on, go easy. Now, hemorrhoids may result from constipation, sitting for long periods of time, and anal infections. In some cases, they may be caused by other diseases such as liver cirrhosis. Now, internal hemorrhoids occur just inside the anus at the beginning of the rectum. Now, external hemorrhoids occur at the anal opening and may hang outside the anus, and it doesn't look pretty. Now, symptoms of hemorrhoids may include anal itching, anal ache or pain, especially when sitting, bright red blood on toilet tissue, stool or in the toilet bowl, pain during bowel movements, one or more hard tender lumps near the anus. Let's look at the signs and tests for hemorrhoids. Now, a doctor can often diagnose hemorrhoids simply by examining the rectal area. If necessary, tests that may help diagnose the problem would include GUAIC. Yeah, sounds really strange, but this shows the presence of blood. Then there could be sigmoidoscopy, there could be anoscopy, and these are the ways and the signs and tests that you could use to detect where hemorrhoid is happening. So, is your anus itching? Maybe you have hemorrhoids. Maybe you need to go see a doctor. And if you strain so much to do bowel movement, then maybe you should start considering your diet and your lifestyle. Maybe you should take more water, you should have more fluids, and you should have more fiber in your diet. You're actually supposed to have 5 portions of fruits in a day. How many of us are actually doing that? You answer that for yourself and let me know if you're doing it or you're not doing it. But I advise you to seriously take note and start doing it, because hemorrhoids could be very painful, and in some cases when it gets complicated you could require surgery to correct it. Now let's leave the hemorrhoids and let's look at the meal of the day. The meal of the day says, good morning, my fasting blood sugar level is 130 with diet control. I do take 1 tin of milk daily. Is it okay? And this came from Chidima. Well, yeah, the numbers are a little bit high, but you know, we gave her excuses, advice of what to do and things to excuse from her diet and the things to cut down and what she should do and not do. And this has helped Chidima a whole lot. And we can do the same thing for you. Why not? We are there for you. That's the whole reason and the whole essence of what we're doing here, to serve you and to help. So get in touch with us. Our contacts are all up there on your screen. Don't forget to tell us who you are and where you're connecting from. And whichever way you decide to connect with us, we'll be happy to relate with you. Until I see you again next time, take it easy with the bowel movement. You know, go soft. Goodbye.